And okay, very good. And here we go. Hello and welcome to Neuro Challenge Foundation for Parkinson's disease. We are so happy to have you guys here today because we have a really great speaker who's going to be joining us in just a moment. And I'm so excited to bring this topic to you because it's really important for people in the Parkinson's community to open up their minds to complementary and alternative therapies that are out there. We're so used to going to traditional doctors and neurologists, and yes, those are important to be able to get our carbidopa, levodopa, and make sure our medications are all right. But it's also a good thing to check in with alternative medicines that are out there. And so Dr. Winder is going to be joining us. Before I introduce him, in case you don't know anything about Neuro Challenge, this is your first time joining us, we are recording this webinar today, and it will be available on our YouTube channel in the next 30 days or so. But I'd like to let you know that Neuro Challenge is a small nonprofit organization that serves the Parkinson's community in the Southwest region of Florida. Since the pandemic in 2020, we kind of expanded all over the nation, and we have a pretty big audience out there and people that like to tune into all the different topics that we bring for education. So without further ado, I would like to read a little bio about Dr. Winder before I introduce him. Dr. Winder finds himself today in his dream job, helping people, working with his hands, and solving challenging problems. He says there's no cookbook approach that works for pain and postural problems. Careful assessment with attention to finding underlying problems is necessary for each individual patient. Dr. Winder feels that the best doctors listen carefully to patients, study widely and continuously, and are willing to think out of the box. Proper preparation can make tough problems simple. He began his career path in biological research, but he developed debilitating headaches in his early 20s that derailed his career direction. Many expert health practitioners tried to help relieve the headaches to no avail. Dr. Winder finally found help in the form of more progressive manual therapies that restored his health. Inspired to start a new career, he now applies his scientifically inquisitive nature to understanding and helping solve a wide range of health problems for thousands of patients in his practice at Gentle Bay Chiropractic. He also teaches and performs research as a natural outgrowth of his clinical work. Dr. Winder and his wife, Mira, have 5 grown children, and they've moved to Sarasota from Western Pennsylvania in 2013. Thank you, Dr. Winder, for joining us today.
Thanks for having me. I'm excited.
Yeah, so we're going to allow you to go ahead and give us your PowerPoint presentation, and you can control the slide deck yourself, and then we'll do Q&A, questions and answers at the end. And for those of you out there watching, you're going to go to the bottom of your Zoom screen. There should be a Q&A bubble with a little question mark in it. And you can type your questions in there for the doctor anytime they pop in your head. Just put them in there. And then at the end of the presentation, Dr. Winder will answer them. Okay, thank you.
Okay, thank you. Thanks, April. So this presentation is on fascia, pain, and Parkinson's. And so before, to get started, we need to start with fascia and how it causes pain, and then toward the end we're going to talk about how this relates to Parkinson's and Parkinsonism. And so to start off, we're just going to start with looking at what is fascia. We're going to talk about why it's important, because it is very, very important. How does fascia cause pain? And how do we fix problems in the fascia? And so to start with, what is fascia? Fascia is fibrous connective tissue that is everywhere in the body. And a lot of people are only familiar with fascia just if they've ever had something called plantar fasciitis, which is pain in the fascia of your feet. But this tissue is everywhere. Fascia comes from the Latin word for cover or covering. It's basically fibers in layers like sheets covering other tissue. and it covers everything in our body. Now, there's some people might be familiar with what's called myofascial therapy, and that is a kind of manual therapy that works with the myofascia, which myo means muscle. So all of the muscles in the body are covered in fascia, but fascia also covers every other tissue in the body. Now, this slide that I'm showing right now is looking at somebody's spine from the back when their skin and fat is peeled away. So this is a shot of a cadaver, but that white band right up the middle is really tough, thick fascia that runs along the back of the spine to protect it. And off to the side, you can see fibers running many different directions. And that's, in a lot of places, that's what fascia looks like. The next slide here, this is something that many of you will be familiar with if you've ever eaten a T-bone steak. There is a very tough band of white fascia that runs along one edge of the steak that you have to cut off because it's too tough to chew. And that is the fascia on the back of the cow, where it's very heavy and thick. So that's something a lot of people will be familiar with. This is a more close-up view of fascia on fascia that's attached to a tendon. And here is another one, that thing that looks like a tree trunk coming through there. This is just a real close-up. That is a tendon from a muscle, but all around it you see those membranes, and those membranes are fascia attaching the surrounding tissues to the tendon. Now, I said that fascia is everywhere. It covers everything in the body. What you're seeing right here is the covering around the heart. On the bottom is the heart with the fascia that attaches directly to it. And then above, surrounding it, is what's called the pericardium. And the pericardium is a heavy fascia that covers and protects the heart. This slide here shows, gives you an inside look at muscles. And the reason I like to show this is to just show that muscles are not just covered in fascia on the outside. Each muscle has individual bundles of muscle that also have a layer of fascia around them. And each of those bundles has smaller bundles called fascicles inside, and each of those is covered in fascia. So there's a lot of fascia in a muscle. And this is a view of just looking at the muscles of the body, and all of the areas that are whitish, those are just areas where the fascia is just very heavy and thick. There's actually fascia covering the red parts in the muscles, but it's just much thinner, so it's kind of see-through. And that's just a nice illustration of different thicknesses there. And so now that we know a little bit about what fascia is, we want to look at why is this connective tissue, why is it so important? Well, fascia basically holds us together. It covers and protects muscles, bones and joints, organs, all of your organs, just like I showed the covering of the heart there, but every other organ has fascia covering it too. All of our blood vessels are covered in fascia. All of our nerves are covered with fascia. The brain and the spinal cord are covered in fascia. That has a special name. It's called the meninges. So when people have meningitis, that means they have inflammation or infection of the fascia that covers their brain and their spinal cord. So this stuff is everywhere, all through the body. And again, it's basically, it's in sheets of fibers, so it's like fabric. It's the structural fabric that holds our body together. It's really, really important for that reason. However, there's another big reason fascia is important, and this one is not very well known yet. And it's another very, very important job, and that is that fascia is a sensory organ. And so in the last 10 to 15 years, they've discovered that fascia has a lot going on in it neurologically. So they used to think that fascia was just this packing material that held our bodies together. And they thought that it didn't have very many nerves. And I don't know why they thought that, because when somebody finally looked, it turns out that fascia has hundreds of millions of nerves. And so we're going to do a little comparison here, because there's one particular job that these nerves and fascia do. And this is, again, this is working as a sensory organ. So we're going to compare our eyes to fascia, because believe it or not, they have similar jobs. And you're going to see how here in a minute. So eyes have 40 million specialized nerve endings. And those nerve endings are sensitive to light. And then what that gives us is a 3D picture outside our body. And that's a very, very detailed 3D picture. Fascia has about 280 million nerve endings, but it has 40 million special ones that we're going to compare to the eyes. So it's a similar number. And these nerve endings are sensitive to pressure and tension, which basically means motion. They're sensitive to motion. And these nerve endings give us a 3D picture inside our body. And this is something that people, aren't very aware of. And so here's why you're not aware of it. So this is basically the most important sense in our body, and it's called proprioception or position sense. And the reason we don't think about it or talk about it is that all of our other senses, the 5 senses that we learn about in grade school, vision and hearing and touch and taste and smell, those ones are all very conscious. We're very conscious when light is hitting our eyes. We are aware of the experience. We're very conscious of sound hitting our eardrums. But the nerve endings in fascia that give us position sense, that give us this internal 3D picture, they don't go to the conscious part of our brain. They go up to our cerebellum and some other portions of our brain, but they never reach our consciousness. We just use them automatically without thinking. And so we're not aware of that picture that we're being given. But that picture allows us to do a lot of very important things, including having balance and posture. So we get position sense from fascia, and that allows us to have upright posture. Your muscles don't know how to contract to hold you upright, even just sitting. Most of you are probably sitting like me right now. To sit upright, your muscles have to contract just so, and to do that, your body has to know where everything is, to know where all your body parts are. Our muscular balance that keeps us in balance with posture, and balances the muscles in the front of our leg to the back of our leg and so on. That requires position sense. Our joint alignment. So my license is as a chiropractor, even though I really don't do the traditional chiropractic practice of spinal manipulation, because I have found working with the fascia and doing fascial therapy to be so much more powerful. But basically, in my profession, joint alignment is very, very important. But you can't have proper joint alignment if you don't have the right information coming from your fascia to give you position sense. And another thing that's really important with the joints is joint stability. And joint stability is basically just holding alignment in motion. When you're walking or running or swimming or anything that you do where you're moving, your joints need to stay aligned to be stable, to protect themselves from damage. And that requires having this internal picture, this internal position sense, giving us the correct picture to keep things stable. And then finally, coordinated motion itself. So basically, without fascia giving us this picture inside our bodies, we can't walk, we can't talk, we can't eat with a fork, You can't swing a tennis racket or a golf club, and so on. But even the most minor things, picking up a mug and drinking tea or coffee, you can't do that because you won't have coordinated motion if you don't have this internal picture that comes from position sense, from the fascia. So one of the things I'd like to point out, then we're going to talk about what happens if you have distortion or restriction. So basically what I work with, my whole practice is based around the fact that all of us, everybody, to some extent through their lifetime, we've all had some injuries of some sort, some type. Some of us have a lot more than others, but everybody's had a few bumps and bangs in their life. And while that doesn't always cause problems in the fascia, it can. So injuries can leave residual tension in the fascia. Fascia is similar to muscle in a way. So our nerves can make our muscles contract and relax. So I can bend my elbow and contract in, or I can relax and let it go back out again. And the nerves can also, like they do to muscles, they can cause a change in tension in the fascia. Now, fascia doesn't contract, it doesn't move our bodies like muscles do, but fascia can stiffen or soften, and it will stiffen when there's an injury. So if you slip and fall on your behind and jar your joints in your low back, that could potentially stiffen the fascia in your low back. If you bang your elbow on the granite counter in the kitchen by accident, or if you're in a car accident and you have a whiplash, or there's just some sports injuries, there's so many different reasons why we could have an injury, and then fascia could stiffen. And then the normal thing is as the injury resolves, as the injury heals, the fascia should soften again and relax. But the catch is sometimes it doesn't. Sometimes with very intense, painful injuries or with sudden impact injuries, sometimes the fascia gets stuck in a feedback cycle where the trauma response gets maintained and it's stuck like a dent in a can. And that's not good. And it's not physical damage. It's a glitch in the nervous system. So there used to be this concept with people who did fascial therapies of many different kinds. There was this thought that restrictions in fascia are adhesions, where all those fibers in the fascia get stuck together. And so a lot of these therapies used a lot of pressure and kind of painful techniques to theoretically stretch and break up these adhesions. And it turns out that's actually not true. That's not what's happening. It's the stiffening in the fascia is happening because the nervous system is stuck, acting like there's an injury. And so basically my work is to find these kinks and dents, as I call them, to find them and release them and restore the picture to normal. Because basically, if you have distortion, if you have restriction in the fascia, then the nerve endings in there that give you your internal picture, they're not going to fire at the right times. If the fascia is not flexible and movable as you move, you might move one way, maybe you twist to the left and your fascia fires off too many nerve impulses, and you twist the other way and you don't fire enough nerve impulses, and it distorts the internal picture. And so those distortions, that faulty information, can cause muscular imbalance and joint misalignment and joint instability and postural distortions and so on. And those things can lead then to anything from very minor stiffness and discomfort all the way up to, if there's enough instability and misalignment and muscle imbalance, you can end up with arthritis or bursitis or tendonitis or problems like that. So there's a whole host of things that can happen. First we're going to talk about musculoskeletal things that can happen. So neck and back pain, headaches, tendonitis, bursitis, rotator cuff pain, and injuries, knee and hip arthritis, hand and wrist pain, foot and ankle pain. These are just a very few of the kinds of things that can be the result of having problems with stiffness and distortion in the fascia. And then there are also many, so I talked about 40 million nerves that give you position sense. And so those musculoskeletal conditions tend to be caused by problems with that. But there's a couple 100 million other nerve endings in the fascia also. And so you can get other types of irritation and problems when you have fascial restriction. And so things that are more like neurologically based issues, things such as vertigo, fibromyalgia, irritable bowel syndrome, neuropathy, the so-called pinched nerve. Most pinched nerves are not actually pinched nerves. Most of the time, it's actually fascial restriction that's just irritating nerves. And so these are all very common things that are the result of past trauma affecting the fascia. And then it's often, it can be immediate, but it's often months, years, sometimes decades later that these little glitches and distortion actually lead to pain and problems. And so actually now I'm going to talk about Parkinsonism. And so Parkinson's disease is most of what we call Parkinsonism is the slow movements, the stiffness, the tremors, etc. And 80% of people with Parkinsonism have Parkinson's disease, and that's when you're getting medication with the L-DOPA, etc. And but I'm going to include the other kinds of Parkinsonism in here too, as I comment on this, because there's some special cases there. But basically, before I talk about how fascial therapy can help, I just want to talk briefly about what we do. So basically, the stiffness in fascia is neurologically based. And so manual therapy that uses careful, gentle pressure in specific ways, in specific directions, can stimulate the body to let go of its trauma response and relax the fascia back to the normal state. And this is even if it's years, decades after an injury, it still can release that tension because it's a glitch in the nervous system. The nervous system is stuck, responding as if you've just been injured. And given the right stimulus, that can let go in just a few seconds. And that in turn restores joint alignment, joint stability. It restores muscular balance and proper muscle tone. It relieves spasm and just it can cause tremendous improvements even for long-term chronic pain. So, and this is something I work with every day with so many different types of pain and problems. And does it address everything? No, but probably 95% of people out there that have some kind of chronic pain, fascial restriction is at least part of it, and a good part of the time it's actually the whole problem. So it's it's a very powerful treatment method to work with the fascia. Now, when it comes to Parkinson's and Parkinsonism, how can fascial therapy help? So the main thing here is pain relief. And that is, I sometimes have people come to me that have Parkinson's, and they've heard of me helping with other neurological issues. I help people with closed head trauma, traumatic brain injury, and vertigo, and some other neurological problems. But Parkinson's disease is not related to fascial stiffness and those problems, but it is often compounded by it. And so my Parkinson's patients that I help, they have had injuries that are separate and have nothing to do with the Parkinson's, and they, the stiffness and the slow movements, etc. And unfortunately sometimes being more prone to falling can mean that there is, not only do they have these types of fascial restrictions that cause pain, but sometimes the stiffness and the limitations in movement exacerbate that and make that situation worse. So restrictions that would be a lesser problem for somebody who doesn't have Parkinson's. It might cause more issues in this situation. And so for some people with Parkinson's, this can make a big difference in their mobility, not by changing the Parkinson's, but just by freeing up restrictions that are adding to pain and adding to the limitations to movement. Now, I said I wanted to mention Parkinsonism in this case, specifically due to head trauma. So this is not Parkinson's disease, but some people develop a condition that is very, very, very similar to Parkinson's disease. It looks very similar with the slowness and the tremor, and the difference here is that this is a problem that actually does respond often to fascial treatment. For example, I'm treating a fellow right now who he had a major head trauma about 17 years ago, and he developed Parkinsonism within about a year after that head trauma. And he's had about 5 treatments so far, and he's had significant decrease in his stiffness, decreased tremor. He has increased mobility, the difficulty initiating motion and then stopping motion is greatly improved. So I don't know, if there's anyone in this group that would apply to, but I like to put that out there because that's a pretty exciting thing to be able to help. But then, and again, back to Parkinson's in general, how much fascial therapy helps someone with Parkinson's really varies a lot. I've had some people come in wanting to get checked out, and they had very little fascial restriction. The Parkinson's was affecting them, but they didn't have much going on from a fascial point of view, and so it didn't really change them much. And I've had others that had tremendous amounts of old injury patterns affecting their fascia and had huge improvements in their reduction of pain and increased mobility. And so that's exciting when that happens. And that can make a big difference. So at this point, I think that pretty much covers what I wanted to go over as far as what fascia is and how it causes pain, and then how it relates to helping people with Parkinson's. So I think at this point we can open things up for questions.
Great. Thank you, Dr. Winder. So first of all, those of you who are with us, if you have questions, please go ahead and type them in the Q&A bubble at the bottom of the screen, and we're going to answer those. And I have some things to say. Just on a personal note, I happen to be Dr. Winder's patient, and about 12 years ago, I went to see him with a plantar fasciitis issue. And I have to tell you that this webinar, even though most of the community tuning in is somebody with Parkinson's disease, this type of treatment is for anybody with any kind of problem, okay? So if you have some type of tightness or some pain or some muscular issues that you might want to get checked out, I do recommend that you reach out to Dr. Winder's office, because he can definitely do a scan and see, if there's any restrictions going on. I had no idea. I'm just going to tell you guys this story real quick because, some of you know me. I had no idea that I was dealing with plantar fasciitis. I mean, I kind of had an idea because my traditional doctor was like, oh yeah, this looks like plantar fasciitis, and you're wearing the wrong shoes. You're overweight. You stand on your feet too long. Like, there were a lot of things they were telling me, and you need surgery, by the way. And I remember being like, my gosh, I was a young person 12 years ago, and I was like, I can't believe this is happening to me. Somebody tuned me in to fascia therapy, and I found Dr. Winder. And I'm going to tell you guys, I went to him, and it was like amazing. within a few treatments, I was completely healed from that plantar fasciitis. He found the restrictions somewhere else in my body, treated them, and released all of those restrictions. Now, we're talking about 10 years ago when I found him. I have never had a problem again. So imagine, if you're having some small problem that you've been ignoring or denying or thinking, gosh, my doctor's telling me I need surgery for this, maybe go get it checked out first by, an alternative practice, something that's different, something that's a little out of the box, because you may not have to go down that route for surgery like everybody else is telling you. So that's just my little 2 cents I wanted to throw out there. I'm just so appreciative of what he was able to do for me. So I hope that if you guys have anything like that, that you might call him in and get checked out. Now, we do have a few questions popping in here. I love to see that. Let's see what we got. Okay.
Sure.
So let's start at the bottom here. Okay, please show the slide labeled conditions. Oh, that might have been right before he actually made it go. So you would probably put that in there after that, right? Okay. Here's another one. What type of scan do you do? Oh, maybe explain what I meant by scan.
Okay, so and that would include then Roger's question: what does fascia therapy involve? So basically, when somebody comes in and they have a complaint or a list of complaints, before I even look at the fascia, I do a full body exam that's not too different than you would get at a chiropractor's or at a doctor of physical therapy. Basically, I'm assessing posture and muscle tone, and looking at joint alignment, joint function, movement patterns, looking for spasm or laxity in muscles. And so there's a whole head to toe exam, just looking to see how things are functioning, and then I actually do an assessment for fascia restriction, and that is also head to toe. As you were saying, April, you said that I found the restriction somewhere else, not in your foot.
Yep.
And that's really often the case. Often the restrictions that are causing pain are somewhere different than where the pain is. So that's why I check everyone from head to toe. I just had somebody earlier today who was having low back pain that was coming from, they'd had an old ankle sprain like 15 years ago, and they'd forgotten all about it. And I'd found there was a really tender, tight little restriction in the ankle ligaments. And when I treated that, their back was tremendously better. So I always look at the whole body from head to toe. And then as far as the therapy itself, the therapy, there are a couple different ways that we release fascia. Most of them involve a gentle pressure that's just anywhere from just a few ounces of pressure to maybe a pound or two. And so it's not a real aggressive type of therapy. It's actually very gentle, because you don't have to beat on the fascia to loosen it up. You have to stimulate it to release. And so, a typical treatment is usually somewhere around, a half an hour or so. And I think that covers that. I hope it does.
Okay. Okay, great. Let's see. Another question is, does his practice accept Medicare?
So Medicare in chiropractic practices is limited in coverage. They only cover the traditional chiropractic spinal manipulation, which there's a very light, gentle form of manipulation using a tool called an activator that I will include in the treatments. It's a very light tapping instrument. It doesn't pop or crack the joints or anything. And when I use that, then there is some coverage, but that's the only thing. Medicare actually doesn't cover the exams, and it doesn't cover the manual therapy for the fascia.
Okay, thank you. Are there any supplements that he recommends in connection with fascia therapy?
So fascia, what's good for fascia is all the stuff that you learned about, hopefully growing up or even more recently, whenever. But there are all these things that they say are important for our health. Well, they're good for our fascia. So hydration, lots of water, making sure you're well hydrated. and eating a low inflammatory diet. That means, lots of veggies and greens and not so much carbs. That helps with reducing inflammation, not so much sugar. That's good for your fascia. Exercise and stretching is good for your fascia. And sleep is important for your fascia to keep it. Fascia it tends to get stiffer and less resilient if you're not getting enough sleep. So just there's no specific supplement for fascia. It's just good diet, good life habits.
Right. And these are the things that we at Neuro Challenge are always telling our people with Parkinson's is to make sure you're drinking plenty of water every single day, because we know that that's not only going to help with just basic health, but it really helps with constipation, which is a common problem for people with Parkinson's. And also we know that exercise on a regular basis, meaning minimum of 30 minutes a day, is going to be the only thing that slows the progression of this disease. So what Dr. Winder is talking about that helps fascia is also what you're already being told that just helps Parkinson's in general. Okay, let's see. We have another question. I don't live in Florida. How do I find a doctor who practices fascia therapy?
It's unfortunately it's not that common yet. And so there basically in the world of fascia treatment, it's not specific to a profession. So there are some good chiropractors doing fascial therapy. There are some physical therapists. There are some massage therapists that are trained to a much higher level. There's even a few. I have a student who's an occupational therapist who does this work. And so basically, you want to Google fascial therapy, or myofascial therapy is what more commonly you can find it. There's many different techniques out there. The techniques that I use, I developed, and I haven't, I run a full-time practice, so I don't get time to teach it that much. So I don't have that many people doing my work yet. But there's a few out there. But yeah, it's you kind of have to just Google it and see if you can find people doing fascia work.
I'll tell you, I found Dr. Winder not just here in Sarasota, Florida. I was in Sedona, Arizona at the moment that I had an injury. And the person that I was seeing was a chiropractor out there for something. And I said, well, I'm going back to Sarasota. This is where I live. And who can I see there that's going to help me with this problem? And that particular chiropractor is who recommended me to Dr. Winder. So, there's a network around the world sometimes where doctors are going to know of other doctors doing the same kind of work. So, maybe to the person who asked that question, you could reach out to our care advisor, Diane, or I can have her reach out to you. And she can do a little research in whatever town you're in to find the right, person, the state or town that you're in. Okay, the next question. I think you explained this, but please explain the treatment differences between chiropractic treatment and physical therapy, or fascial therapy is what they probably mean.
Well, like I was just saying, when it comes to fascial therapy, there are chiropractors that do it. There are physical therapists that do it, and so it's as far as the type of fascial therapy you might have, like I have a student of mine in Ohio who's a physical therapist. He does my work, so he's basically doing the same thing that I do, and that's because we're both focused on fascia. Now, for people that aren't doing fascial therapy, it's there's a lot more differences. Chiropractors do spinal manipulation. Physical therapists do more other kinds of manual therapy and stretching and strengthening and that sort of thing. There's a lot of overlap. There's places where they do the same types of work and places where they're different.
Mm-hmm. Two people are asking, what is the cost of an assessment and treatment? Yeah, how much is treatment?
So we do about half an hour of work. I do 15 minutes, and then one of my therapists does another 15 minutes. And it costs about $95 total. Now, sometimes Medicare will cover, depending, and again, it depends on the kind of, which kind of Medicare and all that. So there's details on how much might get covered. It's not usually more than about 40% is covered.
Mm-hmm.
And in our office, that's Medicare is the only insurance that we participate in.
Mm-hmm. Yeah, and a lot of times alternative therapies, complementary therapies that we find out there in the world, they aren't going to run things through insurance. So a lot of times it is out of pocket. But when you find something that works, it's worth it. Okay, this question, does this have anything to do with PISA or can it help posture? I don't know what PISA is. Do you know what they mean?
I'm not sure.
Okay, to Helena, can you maybe elaborate on your question? We don't know what PISA is or what you're referring to. And we'll move on to another question while you come back in. How is fascia therapy different from acupuncture? Do they achieve the same results?
Actually, acupuncture is a form of fascial therapy. There's a lot of research in the last 5-10 years that has shown that the acupuncture points and meridians are particular areas in the fascial network under the skin. And so you could think of acupuncture as a specialized kind of fascial therapy. It's very powerful and helpful. I certainly have used it, and members of my family have had great success with it, but it's very different from what I do. Acupuncture doesn't release these injury patterns like I do with my techniques. It works in different ways as far as stimulating the body to basically, you can sometimes acupuncture can stimulate changes in digestion, etc., or it can help to stimulate your nervous system to break pain patterns and relieve pain that way. But it's very different than what I do.
Okay. This person, I go for regular deep tissue massage, which at times can be quite painful. Could this be counterproductive if my problems are related to my fascia and not my muscles?
Yes, it could be. Yes. Deep tissue can be very, very helpful, but if it's consistently painful, very often there are fascial restrictions going on, and they can be aggravated by deep tissue work.
Good point. Okay. Explain muscle soreness versus muscle injury.
Well, muscle soreness, if you're just talking about from working out or exercising, that is just a natural consequence of working your muscles a little harder than normal, and it's not really an injury. But what was the question was muscle soreness versus
Muscle. Oh, sorry, I deleted it. Hold on a second. I'll get it back. Da, da, da. Oh, I gotta find it. Muscle injury versus muscle soreness. Yeah.
So with injury, you're actually tearing some of the fibers in the muscle and that sort of thing. And so muscle soreness, you should easily recover from in a day or two, but muscle injury, it could take a week or two, or longer, depending on how bad the injury is. Because you actually have, like with muscle soreness from exercise, there's a recovery phase, but you're not really going through healing. If you actually tear a muscle and injure it, you're going to have to go through the healing process.
Yeah, exactly. Okay, here's a good question. If fascia is holding things in place and has stiffened through the years, when it is released, would that create instability?
That's a great question. And so the short answer to that is no. And there are a few cases, very rarely that could happen, but basically, the fascia is always holding things in place. And if it stiffens, your body adapts to the stiffness and you kind of get used to that. So one of the things that sometimes happens, and I always warn my patients about this, is when your body gets very used to adapting to the distorted picture, it gets used to being crooked. And when you release the fascial strains and suddenly you've got your body's internal picture is much clearer and more accurate, that's going to change your muscle tone, it's going to change your alignment and so on. And so people often get sore and more stiff for a day or two after treatment. But that's just a temporary thing. And then your muscles learn to adapt and so on. So basically temporarily things can feel off kilter to the person when they're used to their posture and muscles and joints being distorted, and it can feel very weird when they stand up after treatment. But after a day or two of maybe a little soreness and stiffness, then things start working correctly, and then they start feeling relief.
Right, because those restrictions that are happening somewhere in the fascia can cause like what's the word, like you kind of compensate somewhere else in your body, right?
Exactly.
For the
Yeah.
problem that might be going on. Like if you're having a lean or something, you're compensating. So now you're sore on the other side. And so it really causes almost a whole body experience when you have these restrictions. And after, if you ignore it, right, and you live with it and you just get used to it, you start realizing that, maybe you don't even have a problem until something happens and you get some pain. You know what people with Parkinson's will ask me all the time is they'll say, April, is this Parkinson's or is this something else I'm experiencing? Like they'll ask me about specific stiffness or the crookedness or something. And I'm not a doctor, so I'm always, quickly to say, you really need to talk to your doctor about this. But remember, not everything is going to be Parkinson's disease that you're experiencing if you have Parkinson's. You may just be experiencing normal aging related problems, or you have an injury that has some restrictions in your fascia that you have not treated. And so the Parkinson's could be masking that, right? The stiffness and rigidity of Parkinson's can be masking a problem you have.
Absolutely. Absolutely.
Okay, good. I'm glad you validated that for me. Okay, let's see, Roger. By the way, Medicare does not cover massage, unfortunately. So I pay out of my pocket. Yes, but we all know that we have to pay out of pocket for a lot of things we like, right?
Oh yeah.
Okay, let's see. What did you say minor fascia therapy to Google?
Oh, okay. It's myofascia, MYO,
Oh,
myofascia. That means muscular fascia. A lot of the fascial techniques are called myofascial therapy or
right,
myofascial release is another way that that's often put.
right. Okay. Back to Helena, who was asking, does this have anything to do with PISA or can it help with posture? She meant with PISA that you tilt to one side.
Oh,
Hmm,
like the leaning tower.
I guess so. I've never heard that before.
um, I For a lot of people it does. Yeah, I treat a lot of people with major postural problems, and so there's this medical term called antalgia, and antalgia is when you lean away from pain. So if somebody's having low back pain on their one side of their back, they may be walking around leaning away from that pain to kind of take some pressure off of it. And sometimes they're not even aware of the pain, but their body just automatically leans to one side. So yeah, we work with posture a lot and with good success.
Yeah, and she says PISA syndrome. So I didn't know that was a real syndrome. Okay. Interesting. Thank you, Helena. You've educated me a little today. Let's see, Roger. I live in Venice and driving to Sarasota, especially during the snowbird season, regularly for treatment just isn't desirable to me. Is there anyone here in Venice that Dr. Winder could recommend? Dr. Winder, who's in Venice?
This in Venice. In
You,
Venice,
oh, don't you still have a practice in Venice?
no, I'm in Osprey,
Okay.
and for a while longer, I'm actually going to be moving my office to Gulfgate, so South Sarasota. But right now, I'm in Osprey. There, there's a physical therapist in Venice, whose name is Jerry Fitzhugh, and she does some types of fascial therapy. She doesn't do the same kind of work that I do, but she's very good.
Okay. I might get that number from you later. Okay. Is this similar to Rolfing?
Oh, that's a great question because that gets into the history of fascial work. So the first person in modern times to work with and develop a fascial therapy was Ida Rolf. Ida Rolf was a chemist. And gosh, I mean, that's about 80, 90 years ago that she developed a technique. She called it structural integration, but a lot of people just named it after her and they just called it Rolfing. And it was it was a very brutal technique because Ida was a brilliant woman and she understood how important fascia was, but she didn't understand how fascia worked neurologically. And so her technique was very, very forceful, very effective, very powerful. She helped a lot of people, but it was a very, very painful, painful technique. So the work that I do is nothing like that. It's not
Hmm.
at all. It's very, very gentle.
I can attest to that. Yes. All right. Wow, we got through quite a lot of questions there. So I don't see any more popping in. If you have one, please throw it in there while we wrap this up. But Dr. Winder, it's been a pleasure. Thank you so much for joining us. I'm so glad to share this therapy that you offer with our Parkinson's community because I do think that there are a lot of underlying problems that Parkinson's can sometimes mask. And so maybe it's time for some of these folks to look at that and see if it could be treated, some of their other problems that they can't see, but they can feel. So, oh, there is one more question. Oh, Roger. Okay. Thank you so much to Neuro Challenge and Dr. Winder for this super informative and helpful webinar. I learned things today about the fascia that I never knew. Amazing stuff, which makes complete sense. Oh, thanks, Roger. So
Thank you.
listen, please check out his website. And I know that we usually follow up these webinars with some information about your practice, with links to your website, because there are some good videos on his website that really go into like more like fascia and some history and stuff, and I like to send people there when I try to explain it because I'm not a doctor to explain it, but that's what we will do. Follow up this webinar with some more information to those people who participated today. So again, thank you, Dr. Winder. I hope you have a wonderful day, and everybody out there
Thanks
have a
for
great
having
time.
me. Yeah, have a good
Thank
day.
you. Take care. Bye-bye.
Bye.